Hello, and welcome again as we look at some additional ways to manage discomfort during pregnancy. My name is Donna Zubrod. Some of you may recognize me as I'm a fertility awareness educator at Reply. In addition to that, I'm a nationally certified and state licensed therapeutic massage therapist, also a birth doula and a Spitting Babies Aware practitioner. I've been working with couples for the last 11 years, birthing couples in the Triangle area. I teach them self-care techniques to manage discomforts at home, in addition to offering sessions for individuals and couples in my studio. So in our previous session, we discussed that discomfort in pregnancy is indeed very common, but it's not normal, and there are reasons that this is happening in your body. Basically, it's because your body overall is trying to adjust for all this extra weight that's at the front of the body. And most of the discomfort and most of the stress that's being put on your body is in the back. Your shoulders, around the bra line, coming down to the waist and deep into the hips. And that compensation can also translate further down into the legs and actually cause rotation in the hips that can cause cramps that you get in the back of your legs, particularly at night. So I also demonstrated in the first session some self-care practices that you can do alone and with your partner to help manage the discomfort and bring more balance to your body. I hope you've enjoyed working with some of these I discussed and demonstrated for you in the first session. Our focus today, from the most common questions that I get asked by my clients, is we're going to discuss things to keep in mind when moving about and resting during the day. How to bolster yourself for comfortable sleep. Many of my clients say they just can't get comfortable. So we'll look at some ways to help augment that. Additional techniques that the partner can apply to pregnant moms as they're reclining in a side-lying position. And in this unprecedented time where we're dealing with a worldwide pandemic, having techniques that you can apply while you're staying at home can be invaluable. And then finally, I want to discuss ways that you can get additional support if these at-home practices are not helping to make you more comfortable. And a reminder, as I mentioned in the first session, if at any time you're experiencing pain, it's wise to always check in first with your care provider and to get approval to do some of the exercises and stretches that I'm doing today. So I am seated. And one of the most important things to remember when you're seated is dynamic seating. So it's always good to keep moving. That's because as I'm moving, muscles right now in my hips and in my legs, they're contracting and then they're expanding. So they're contracting and then expanding or relaxing. So whereas if I stay like this all the time, the muscles aren't doing anything, and muscles at rest will just, the tissues, the supportive tissues around them will kind of lock down, and then the muscles lose the ability to expand and contract the way they need to. So something to think about. So good idea to sit at the end. I'm going to show you with the aid of my handy pelvic model here. Your sits bones are at the back of your pelvis. They're what you feel as you're sitting, and you can try this yourself. Rocking back and forth, and you should feel something hard underneath your butt cheeks. Those are your sits bones. And all the tissues that are around here at your pelvis, this is when I was talking about muscles getting tight. Your pelvis is meant to do this and to do this during birth. And you'll know what I have attached here now are rubber bands that are acting like muscles that are expanding and contracting, expanding and contracting. They also, muscles not only provide additional stability in your body, but they're also providing stability to the bones. So here we go. They allow for movement of the pelvis, which this is all very important as you get ready for your birthing time. So these are the muscles back here that we want to keep, we want to prevent them from getting stuck. So continually rocking, if you're on a hard surface, an exercise ball is great. if you have one. I'm going to show you something that I sometimes sit on here. It's, I use it sometimes for balance, but it's like partially inflated so that it actually allows me to move very easily from side to side. You can also get a beach ball left over from last summer and let most of the air out of it, and you can sit on that. That'll give a little bit of a cushion for you, or an inner tube, and either of those will work very nicely. So we don't want a stuck pelvis. Sitting forward on your sits bones as much as possible is good. Relaxing backwards in an easy chair with the legs up, I remember during my pregnancy that was really very comfortable, but it wasn't optimum for the position of the baby, and it actually caused a lot more back pain, because what was happening is as I was sitting backwards, I was kind of, the pelvis, my tailbone was rocking underneath, and that's just really not good for posture. And I had a lot more back pain, even though I felt that I was comfortable reclining and that I was doing a good thing. So if you feel you need to recline, a nice way to recline is Sidelying. And I'm going to show you in a little while how to bolster yourself properly in a Sidelying position for sleep and just for comfortable if you're watching TV. The other thing is that the relaxin, one of the hormones that's being produced in your body right now, is helping to relax the ligaments so that this also happens a lot more readily in your body at this time. And one at the ligament at the front is called the pubic symphysis. And as it relaxes, it can get loose during pregnancy, and it can cause the pelvic bones to shift slightly. And this area is full of nerves, and it's possible that it can be pinching a nerve and you can be very uncomfortable. So the best way to avoid making this separate even further is that as you are, I'll do this sideways so that you can see, if I'm getting up from seated or if I'm getting out of a car, I move with my knees together and then I stand up. Again, I'm getting out of the car, we're standing up, and I want to go in that direction. I'm going to move my knees together and get up. Many of us will remember this as the cotillion move. You don't want to go like this. That's going to cause, you can just imagine what that's doing to your pubic bone at the front of your body. So things like getting up and down from seated, getting in and out of a car, getting out of bed, always keep your knees together. So that is what I wanted to talk to you about, moving about and resting during the day. Now I'm going to get my massage table set up and ask my trusty birth partner to come in here so that I can demonstrate for you how to bolster yourself for comfortable sleep, and also some additional partner massage techniques that you can practice at home. So now I have enlisted the participation of my trusty birthing partner, who's very pregnant at this time. And I'm going to demonstrate how to bolster for comfortable sleep. If you remember from before, the first session when we were talking about the different types of what's happening to your body structurally as a result of all the extra weight at the front of your body, we talked about how everything that we're trying to do is to bring you more into balance. So as I am bolstering, I'm trying to help the body come to a neutral position. So to start, I want my partner to be lined straight, not bent up, curled like this. Many of you have a variety of pillows and supports. Many of them can work. I'm just showing here how I recommend my clients bolster themselves and how I work with them here in the studio. And again, this is a massage table. You may not have a massage table at home, but imagine this could be the edge of your bed, or it could be lying on a sofa in your living room. Okay, so some support under the belly. This is a triangle wedge. Okay. We bring the bottom leg straight. The top leg is bent over a pillow. And I did forget, you need to have support under your head. Arm comes this way, there. And want to make sure that the head is, that the spine is also neutral, that the head's not, that's along with the spine. And when I show you this from the other angle, you'll see more what I mean, but I can tell from here that he needs just a little bit more there. And how does that feel?
Good.
Good, okay, great. Again, trying to, the body is being pushed and pulled into this position because of the extra weight. We want to be up and open, so there are additional pillows. Another one here at the front, and another one between the bended knee. And again, another one. This really helps under the arm, call it the hug pillow. It really helps to open up and help with breathing. If you're having some issues with swelling, which is very common in pregnancy, you can put a rolled up towel or even another pillow here so that your wrist is higher than your elbow, is higher than your armpit, and that allows the fluid to drain. Similarly, if you're having a lot of swelling in your legs, you can put additional pillows underneath here so that the ankle is higher than the knee, is higher than the hip. And again, as you're resting, it can all drain. Okay, that's a good sleeping position. Now, how about rolling? Many people will roll just by, in turning position, will just roll onto their back and get onto the other side. And yes, we do have a pillow fort here. And I do realize that the pillow fort does get redone. But think about what I was showing you with the pelvis before, where I was showing you how to stand up with your knees together. You also want to roll with your knees together, and that's much easier to do if you first come up onto all fours and then turn over facing forwards as opposed to turning onto your back. So I'm going to demonstrate that for you. Some of the pillows need to come out. Do that. Okay. What I'd like you to do now is to turn forwards. Come up onto all fours with your knees. That's good. Okay, stay there for a second. That's nice. And now turn on to the other side. Okay. Here we go. So now you're going to have an opportunity to see the bolstering from the other side. And when you're doing the massage techniques that I'm going to show you, again, notice how he's lined up nicely along the edge. So I have a hand's width at this part of the bed, a hand's width here, and a hand's width here. And that allows, that's helping to put the body into a neutral spine. Colin, can you curve forwards for a moment like this? That is not a neutral spine. I have two hands that I can fit here. And that all that's doing is it's not allowing the body to reset into that more neutral position. Okay, come back, there. Okay, so I will quickly redo the bolstering. Under the belly. Bottom leg straight. Top leg bent over the pillow. Nice job there, Colin. You're doing great. Okay, hug. Let's bring that knee up. And again. And here's the hugging pillow. Okay. So this is, if you remember from the diagram I just showed you, the posture diagram, this part of the body is really tight and under a lot of stress. And it's very easy to massage this body. So using the palms of your hands. And you don't want to be pressing on bone. If you press on something and it's hard, you're on bone. If you press in here, these are the gluteal muscles. It's nice and soft. So just by moving back and forth with your hands, this is known as cat paws. Nice and slow. Another thing you can do is the gluteal sandwich. And this is what is being done. Clasp your hands. With the palms of each hand, you're going to pull up the soft tissue between your hands, and you're going to compress it and lift it up a bit. So here we go. A little bit hard to do with blue jeans on. How does that feel, Colin?
Okay.
Feels great. This is the most appropriate place, and it's very effective to do the gluteal sandwich here. The rest of the body, so this is the spine. What you can do is just use cat paws on the shoulder, all the way down, either side of the spine. Take your time, ask your partner, how does the pressure feel, Colin?
Oh, feel fine.
Pressure feels fine. Another thing I wanted to show you from working with clients is everybody's got a different shaped body. And sometimes it helps, depending on how wide your hips are, to also put a little roll underneath, lift your waist a little bit. Right up here at the waist, okay, come down again, to provide additional support at night to sleep. And you'll know if you need that. You can experiment with that. So I can tell that my birth partner here is just about getting ready to start to snore. So I'm going to cut here for a moment, and I'm going to help him off the table, and then I'm going to come back and give you some more things to think about. So I've shown you a variety of things that you can do to help you stay comfortable as you're moving around during the day and resting, and how to bolster yourself more comfortable when you're sleeping, and also things that your partner can do with you to help maintain your comfort level. And I recommend that these things be done frequently, daily if possible. It's the little things that we do every day on a regular basis that really make a difference in the long run. So I encourage you to integrate these techniques into your daily routine. Sometimes we come into pregnancy with our postural baggage to begin with, and sometimes these self-care techniques aren't enough to help get you as comfortable as you can be. So sometimes it takes a village. And so you may want to ask your care provider for some recommendations, in particular though, to practices that focus on perinatal, and postpartum, with those that have advanced training and working with people in their childbearing years. So therapeutic massage can be very helpful. Chiropractic, pelvic physical therapy, acupuncture, yoga, birth fit, and we have a great program here in the Triangle, also highly recommended. And spinning babies has, many of us have been trained in the techniques, but they have a very comprehensive online information and training programs to things and classes that couples can take to help learn a lot of the techniques. Highly recommended. So in addition to looking at other providers that can help you, other providers in your village, I highly recommend this book by Elizabeth Noble, Essential Exercises for the Childbearing Year. And some of the things that I have shown you today have come from this book. So thank you for tuning in. It's the little things we do every day that make a difference in the long run, and I encourage you to integrate these techniques into your daily routine and do them often. And have fun while you're doing them. If you're patient at Reply and you have any questions, you can contact us at 919-230-2100 or via our patient portal or the Reply Health app. And if you'd like to get in touch with me personally, my email is dzubrod@replyobgyn.com. And as always, you can find us and many of our resources at www.replyobgyn.com or on any of our social media channels. I'd like to end by offering you all birth blessing. Thank you.